Welcome, everybody. We're just going to take a few moments here to get everybody settled as we go into our last breakout session of the day. Hope everybody's had a great day, attended some good sessions. I know I have. So once again, just letting everybody get settled for our last session of the day. And then I just have a little bit of housekeeping before we turn it over to our final speaker. All right. I think everybody's settled in and with us. So if you don't remember me from this morning, or if I haven't had sessions with you, my name is Noah Lemaid. I'll be the Institute representative here in today's session. And I'm just so glad that you guys were able to join us today. Again, I hope you were able to attend some wonderful sessions. As a reminder, the way that you're going to get your certificates of completion for attending today is by filling out our evaluation. That evaluation is available on our conference portal webpage. It's linked right at the top. If you try to click it right now, it's not going to work for you, but it will open up after 4 p.m. Central Time. That's the time that this session ends. So immediately following, you can go in and fill that out. Then we will email out certificates on May 1st to everyone who completed that evaluation. So you won't get your certificate right away. You'll get it on May 1st. And you want to make sure you complete that evaluation prior to May 1st to make sure you get your certificate. Okay? So without further ado, I'm going to go ahead and introduce our final keynote, our final breakout session speaker of the day, Belinda Mori. Belinda Bell Mori is a clinical substance abuse counselor with 10 years sober from who is 10 years sober from methamphetamine. She holds a bachelor's in addiction counseling and is pursuing a master's in clinical mental health counseling. Bell works as an outpatient counselor, recovery coach, and serves on advisory boards, including CleanCircle.io and Vital Voyage. And without further ado, I'm going to turn it over to Belinda.
Hello, hello. Thank you all so much for joining me today. I'm so excited to do this presentation. Um, I just feel really honored to be here. We've had some amazing presenters today, and I'm just excited to be here to kind of close things out. So, we are going to be talking today about breaking down stigma and shame. So, I am a person in recovery. I am also a clinical substance abuse counselor. I've formerly been a EMT. I'm a mom, a wife, and one of those people that are doing all the things all of the time. So today I want to talk about something that keeps more people stuck in addiction. Addiction and recovery for me are a huge topic. It's what I do professionally, but it's also just a huge portion of my personal life. Um, and what I really want to talk and share about is that in addiction, in pain, and sorry, I want to talk about something that keeps people stuck in addiction, that keeps them stuck in pain, and that keeps them stuck in silence more than any diagnosis or drug. It's really the shame and the stigma that comes behind being a drug addict or a user or an alcoholic or whatever label we end up putting on it. This isn't just another addiction talk. Shame and stigma, they really ripple through every single part of healthcare. Addiction, mental health, pain management, primary care, chronic illness, anywhere people end up showing up with those complicated stories. And if we're not careful, shame is what's going to keep them and us sick in some ways. So, I grew up in northern Wisconsin. This is where I grew up, got in trouble, started doing drugs, got addicted. But this is also where I ended up getting sober. I've worked in local hospitals up in Vilas and Oneida counties. I've run EMS calls on some of the craziest back roads where you end up having no cell service. It's completely isolated. You have no idea where you are. And the winters up north here can be just rough. But up here, shame doesn't just sting. It keeps people from really ever coming back for any kind of help. And this isn't just a problem here in our local community. This is a problem that's really in all of our communities. It's in our ERs, it's in our clinics. You can see it in our waiting rooms. You can hear it on the phone, right? And it comes home and it lives with a lot of us here at home. So, where my story today for you guys really begins.
Belinda, I just want to make sure we're not seeing your PowerPoint right now. I don't know if that's intentional at this point, but
Nope. Hang on. Let me see what happened. I'm so sorry.
no, it's okay.
Bing.
It's loading. And then there it is.
Okay, perfect. Okay. My apologies on that, guys. Technology, right? Okay. So I want to take you guys back to a night that honestly still lives under my skin. Okay. Ugh. I remember the ambulance bay doors hissed open and that cold winter air came rushing in. It was sharp, it smelled piney, it smelled like diesel fuel, metallic, and just that cold winter air punched into my lungs. My boots were still crunchy from the last overdose call that I was just on, and my heart was absolutely still pounding in my chest. We rolled in patient, mid 30s, track marks, angry under the fluorescent lights in the ER, their eyes wide open with that complete mix of fear and defiance that you kind of only get when you've been judged too many times to bother even hiding it anymore. I listened to that patient all the way to the hospital tell me how much he didn't want to go to the ER because they weren't going to do anything for him. Because the last time he was there, he heard the doctor over say, I don't know why these people keep coming back. I don't know why we have Narcan. We should just let them die. And I sat in the back of that ambulance with that person, racking my brain, trying to figure out how to tell them that somebody cared and how to tell them that they were more than their drug of choice and more than their substance use disorder label. I almost felt like it worked because he became a little more calm and sounded like he was going to be okay going to the ER. So we're rolling him in the doors. And all of a sudden, the nurse comes around the station, and here she says, here we go again. I watched the light in that patient's eyes change right then and there. The doctor barely looked up, clicking his pen, writing on his sheet, like this kid's story is already written. You could see it. The healthcare providers, the doctor, the nurses, they were tired, tired of seeing people come in, tired of just helping them temporarily, shipping them out, and then they're back again. I knew that look on the doctors and the nurses' faces because I'd worked in the ER long enough to see that. But I also knew that look on my patient's face because I had been that patient. 10 years earlier, I was the one on that gurney, shaking, throwing up, screaming for help, telling them I just wanted the pain to go away. I remember that. I remember what that felt like. And I looked at that patient as we transferred him into the hospital bed. And I didn't have any words that I could tell him to let him know or to make him feel like anything was going to be okay. We finished the call, cleaned the rig, went back. I did my report. And I felt so dirty and dejected, and I didn't know what to do. And I felt shame. That same shame that I had felt when I was on that gurney, it was like I was reliving it through that patient that was there in the ER. Physical feelings of it, the mental feelings of it just came flooding in, and they stayed with me that entire shift. A lot of people think that when you get sober, then that just fixes the shame. But nobody tells you about the shame that comes after getting sober. The kind that even follows you when you're doing well and you're wearing the EMT uniform because of where you came from and what you did. So here's the ugly truth that I learned in those long Northwoods, freezing cold nights, hot summer nights. The shame system meant to save us is wired, excuse me, the same system meant to save us is the same. Sorry, I can't pronounce things. Sorry, a little emotional from that. The same system meant to save us is wired to shame us, right? We have to go to the doctor. We have to get a diagnosis. Insurance needs the diagnosis to be able to bill, to be able to pay the bill. But every diagnosis is a label, right? And people get labels not because they're bad, right? We get labels because we need them for the medical system. We get labels because that's the easiest way to categorize things, right? We get labels because that's what culture at times dictates. And a lot of the times we end up judging what we can't fix. We distance ourselves from pain that could be ours. And it's not just substance use I'm talking about. I've seen it with chronic pain patients labeled as drug seekers, right? The diabetic person labeled non-compliant, and the parent of a kid that has ADHD, that's just called difficult. I've seen the person with depression feeling rushed or brushed off by their therapists. And in rural places, like a lot of the places here in Wisconsin, it's worse because every single person knows everyone, right? And everybody talks. As much as we talk about HIPAA compliance, right? Everybody talks. It's just a reality, okay? It shouldn't be, but it does. One bad night in the ER, in the doctor's office, in the clinic, right, becomes your whole story. Your whole story. And that's all people know. And that's all people see. So, where shame lives, we kind of talked about this, right? The emergency room, pain seeker, non compliant, frequent flyers. That's one of the first things I learned about when I started working in the ER were our frequent flyers, because the key was to give them a sandwich and a soda, send them on their way. But we never addressed any of the other issues, right? So I want you to think about this, and you don't have to interact if you don't want to, but I want you to think about if you have ever felt judged. Now, whether that was in a hospital, whether that was as a patient, maybe you felt judged as a provider, a new provider coming in. We all know that carries through, right? Maybe you felt judged as a parent or whatever reason. Now, I want you to think about that feeling. Think about that feeling of being judged and the thoughts that run through your mind. And if a couple of you are willing, you could put in the chat like what those thoughts might have been. And if you can't think of the thoughts, I want you to think about The physical sensations maybe that you felt in your body. What did that feel like for you? I want to give you some time to think about that. Does anybody have anything that they'd be willing to share? Oh, okay. Shame, frustration. Yeah. Pit in the stomach, that's a great one. Instantly shut down, right? They just woof. The walls come up, right? I call that the Iron Man mode. I don't know if you guys have ever seen the Iron Man movies. Most of us have now, right? Tony Stark, right? All of a sudden that suit comes all the way up. Yep. Wondering if they would believe me, tense and heavy. Oh, Chris, yes, the gut punch. It's hard to open up when you feel judged as a parent. Yeah. Yes. I'm a parent. I have two kids. I have one with ADHD and one with ADHD and autism, right, on the spectrum. And oh my God, have I felt judged as a parent? Good Lord. It is so real, not wanting to come back or seek help. Yes. That one right there, that's huge, right? That one's huge. Thank you so much for sharing that, you guys. That's amazing. Okay. So I want to share a little bit about here's what I hear every week, I think, since I've been practicing, whether it's in residential or outpatient or coaching, right? This is what I hear. I hate, I hate the medical system. Doctors look at me like I'm trash. Nurses roll their eyes. Everybody's the enemy, right? Shame doesn't just hurt feelings, it ends up turning us that are trying to be helpers into the actual enemies. We're the bad guys. I don't know about you, but I'm not trying to be the bad guy, right? I'm out here trying to be the person I wish I would have had early on, right? With no judgment and no shame. Somebody who's actually just going to listen. But that's so hard to find out there. Shame is just one of those things that we just don't talk about enough, right? People end up leaving the ER, they leave the clinic, and they end up smaller and more dysfunctional and more broken than when they ended up walking in for services to see us, regardless of where you work or what you do. That's a problem. That's something that we really need to start thinking about. Of how do we change that? How do we keep people from walking out of our door? Because once they're gone, they're gone. The chances of them coming back are pretty slim to none. So they stop showing up, they stay sick, and that shame continues to ripple out everywhere. Addiction, diabetes, pain, mental health, ecology, right? Every single dynamic of it, every facet. So here's the question that I end up sitting with, I think, almost every day. How do you convince someone who's being treated like crap, just being honest, right? By the white coats or by those same people that can actually help them right now? How can we do that? How can we even start some of those conversations? And honestly, I'd love to hear from you guys to see what what you guys think. And I don't want it to be a sugar-coated conversation, right? When I talk to people and try to convince them that it's still worth trying to go see someone and I'm trying to teach somebody how to advocate for themselves, I don't sugarcoat it. I tell them my story. I tell them other stories so they know they're not alone in those feelings. Yes, building trust, huge, right? So in therapy, regardless, right? Therapy, the one common denominator for successful therapy is the therapeutic relationship. right? But it's hard to build that relationship when the walls are already built up. So the empathy, the understanding, really understanding how to connect with people and stay within your ethical boundaries, regardless of your practice, right? Regardless of what part of the system that you're working with. All right. Um, sorry. So first, we name the wound out loud, right? That shame you feel, I tell them it's not just you. It's baked into the system. It's rushed into charts. It's whispered as labels. You watch it when people avert their eyes or don't make contact with you, right? Recent studies in rural ERs and clinics kind of confirm it. Assumption making and discrimination create those deep trust rifts, and those stay incredibly long. And to break those patterns takes an incredible amount of work, right? And the lack of autonomy makes it worse, right? One bad experience becomes your reputation, no matter the diagnosis. So if you're going to a hospital system, and most of us have larger hospital systems in our area, right? If you mess up with one doctor at that hospital system or end up with one label that follows you, it goes to every single provider. And especially in our rural areas, I don't know about you, we have two systems up here, right? So if you screw the pooch on one, right? And you go to the other one and you do the same thing over here, then where do you go? You go nowhere. You stop looking for help unless it's an absolute emergency. And even then, you don't go in. And that's where people aren't getting help. They're not getting care. They're not having follow-ups, right? Case management isn't happening. And that shame continues to spiral. And too many people, we're losing too many people. Too many people are dying from this right here alone. Not disease, not overdose, right? The shame. If you look underneath all of those things, the things that keep people sick, that shame, that fear of judgment, that's a huge thing and a huge thing that we need to continue to work on. So let's try something a little simple. I want you to think about one thing a provider could say or do to make you feel safe sharing your full truth. What do you think is truly something that you could share, a message that you could communicate somehow, right? That could make somebody feel open enough to share their truth. And we don't have to overcomplicate this. I love KISS technology. Keep it simple. You matter. Ah, yes. Tell them it's a safe space. I always start with recognizing and validating their previous experience and ask what would be helpful. Yes, what they need from me to build a better relationship or what their ideal. I love that. Their ideal. Yes. I'm here now. I don't know what you've done in your past. I know you for who you are right now in front of me, wanting to get better. Ah, Madison, that's absolutely beautiful. I love it, you guys. Those are amazing. Using someone's name goes a long way in humanizing them. Yes, right? Frank, it's so good that you came in today. I've been thinking about you, Frank. How have you been? Right? Rather than, hey, how's it going, man? How you been? Yes, thanking them for coming in. I'm so glad to see you today. Oh, I saw you on my list today, and I was like, it's going to be a good day. Frank's coming in, right? Sometimes the things that are as simple as that, smiling, right? Some of us forget we have that RBF face, right? It's so funny because my family will watch me sometimes when I work from home, and I'll be like on a free virtual group I do on the weekends, and I'll be there and I'll be talking and chatting. And then as soon as the group's done, I'm like, and my face just drops, right? But when I'm smiling, people can, even if they're not looking at me, they can hear it in my voice, right? That eye contact, exactly, right? It makes a huge difference. Looking at the person, not always typing, right? Or taking notes. I mean, sometimes we have to do that, of course, but maybe taking that moment to stop and really look at them and listen to the answer and then go to type it. Those teeny tiny things. A client discharge meeting, he said it was really helpful to acknowledge that must have been so hard for you. Yes. Just acknowledging that. That's huge. I love it. Fantastic. Okay. All right. So, in a lot of the work I do as a counselor now is I do a level of self-disclosure, right? And I have to be careful with that because there's those ethical boundaries, right? But I tell my clients I've been on both sides, from the gurney to ambulance to the EMT and now the counselor's chair. We practice scripts in session, how to talk to your providers, how to advocate to your providers, right? My history is part of my health. I need care, not judgment. That's one of my biggest ones, right? I need you to know that my history is part of my health, but I need care from you and not judgment. And we role play and we go back and forth with these conversations, whether it's asking for a simplification, right? I don't understand what you said to me. Those are a lot of big words. Can you simplify that down, right? Or saying, can you slow down? I don't understand. That patient advocacy, truly teaching our patients and our clients and the people that we see that, hey, you're paying for a service. I don't care what kind of insurance you have. I don't care if you're on state insurance or whatever. You are paying me for a service and you deserve the service that you are coming to get within all reasonable bounds, right? But they are our patients. They are coming to us for services and they deserve to be treated as such, right? But they also deserve to know that it's okay to demand that, to ask for that. Okay. When even one nurse or doctor, dentist, counselor, therapist, okay, doesn't matter what flavor we are, right? Chooses compassion over judgment, the whole room changes. I've seen it happen in the ER. All of a sudden, we're working on a patient, and for example, this one patient we had came in, they had been Narcaned, brought them in on the ambulance, and we get them in the room, and I had a very tired nurse and a very tired doctor in there, and the respiratory therapist comes in, right? And the respiratory therapist came in like a bolt of rainbow sunshine, okay? And treated that patient like they were the most important thing that day. The doctor stood up a little straighter. The nurse got a little bit more compassionate. The whole room changed just from one person, right? Just one. And this isn't just about, again, it isn't just about addiction. It's honestly for any single person out there who's ever felt this big in healthcare, right? One good moment multiplies. Okay. A patient stays instead of bolting. A family member speaks up. A connection gets made. That's how the systems shift. Not overnight. We all know that nothing happens overnight, especially in any of the medical field, right? In any of the helping professions, in any dynamic that where we work, okay? But it shifts by millimeter. Teeny tiny little changes that slowly start to move the needle. And as frustrating as that can be, and as hard as it is to have patience with that, I think that's one thing that we all have to remember is that it does move by millimeters at times, but it moves and it will keep moving. If we start making the next right decisions for our clients, for our patients, right? and truly advocating for them, we're going to be able to do so much more. We're going to keep them in the door. We're going to keep families together, right? Hopefully, we're going to keep saving lives, right? We're going to keep helping people and doing the things that we are all trying to get out there and do. All right. So we've talked a little bit about like different things we could say, right? So I want to ground this in action a little bit more, right? And I want you to think about what is one thing that you could do in your profession, right? Or your schooling or your everyday day-to-day life, right? As a person, as a provider, as a peer, as a community member, what's one thing that you can do in the next week or so to try to make one person's day better, one person's story a little bit lighter when you see them? And again, if you're willing, I'd love to hear some ideas in the chats. And this is a little bit harder one to think about, right? But again, any way that you can work to really break that stigma and that shame, to truly put things into actual action. Nora, I love that. Validate their experiences. Yes. Love that. Pause, look at the person and really listen. Yeah, that active listening, which is not easy with all the distractions in the world today, right? Every time the phone goes off, the light goes off, an email thing dings, a message dings. Oh my gosh. Yeah. How about out there in the community? What do you see in your communities? And is there anything that you can actionably do to help change things? Yeah, making sure you're using their names. That's great, right? Asking questions with respectful curiosity rather than judgment. Yes, I love that. I had the absolute amazing pleasure of working with some trans folks when I worked in residential treatment, which was fantastic because I didn't know anything about it, right? Just sit down with somebody and say, you know, I just want you to know, like, I don't know much about trans or the trans community. I'm sure I'm going to make mistakes and say something stupid because I don't know, but I would love for you to share with me what you feel like I need to know about who you are, your process, your journey. And I need like the top three do not do this list, right? Make it a little fun for them, right? Let them set the rules a little bit, empower them, acknowledge people and model treating someone you may believe is struggling with mental health or addiction with dignity and respect, right? Right? Instead of avoiding the person in the waiting room that is, ticking or fidgeting with things or is up and down, and you're like, are they okay? Are they not okay? Why don't you go, hey, I just noticed that you seemed a little anxious today. Are you doing all right? Is there anything that I can do to help you? Do you need something to read? If you'd like to go maybe walk in the parking lot, if that's safe, give them different options to make them more comfortable, right? I love your ideas though, you guys. Those are fantastic. Beautiful. Yeah, so that compassionate care, right? So really using those moments of those genuine connection, right? All of those things are so important. So, a couple of things, right? That I will share as well. So, using that first person first language, right? Language matters, right? And if we don't know the language, ask. Okay. I'll definitely do that sometimes instead of tripping on my own words. I'm like, LGBTQ, and I think there's something else. Could you help me out? Right? Like asking those questions and not being afraid to be wrong, I think is huge. And meeting people where they are. That's one of the huge ones. I just had a huge moral ethical dilemma back in January for this right here. We have to learn how to meet people where they are with no lectures and no judgment. Because if we can't meet people where they are, how are we going to help them? People that need our services are not always going to fit in those nice, beautiful, shiny boxes. They're just not. And then we lose too many in the cracks. And then we have whole sections and populations of people that are suffering and stuck in the stigma and the judgment and the shame. And again, we're losing too many people. I don't care who they are. I don't care what they've done. I don't care if they have a criminal past. I don't care if they're homeless. I don't care if they have the worst criminal charges out there. People are still people, and they deserve our respect when they're coming to us for help, and they deserve us to actually be there, fully be there to be with them. And I think that's something that gets lost in the translation a lot. And we're all busy, right? We're all overbooked. We're all overworked. We have caseloads out the woof, right? It gets crazy. But we have to remember that we're dealing with people too. Celebrating every single progression, right? So my business is progress, mile or a millimeter, because I think that's that important. It doesn't matter if our clients and our patients are making giant leaps, which is beautiful. Like we love seeing that action, right? Like, whoa. But at the same time, sometimes it's small, almost unmeasurable progress, right? Maybe they didn't make it to their appointment today, but you know what? For the first time, they called and let us know they weren't going to be here today. That's a win. As small as that is, that's a huge win. Asking the people that we work with, what's progress look like for you, right? What are their expectations? What does that truly look like for them? And if they don't know, helping them figure that out. What are their goals, right? If you catch yourself judging, because honestly, we do this, right? We're human beings, none of us are perfect. But if you catch yourself judging, pausing and asking, what's the story that I'm telling myself in my head right now about this person? What am I thinking about them without even knowing them? Where did my brain just go? Right? What are our own biases? Demanding stigma training. I think judgment and stigma training, talking about this, having trainings on it, truly educating ourselves about this is huge as well. And we don't like to talk about it because if we're judging and there's stigma with our patients, then we're doing something wrong. Oh my God, we're wrong. We're in trouble. I can't be in trouble. I didn't do that. But we're not perfect. We're just people too. We all have bad days, right? Another thing um, that's out there right now, especially in addiction and treatment, is bringing those peer supports into our waiting rooms, into our offices, into the telephone conferences, into virtual health, right? And honestly, peer support isn't just addiction recovery, mental health, right? You have those people that have battled through cancer, right? Made it out of diagnoses. People that are living with MS, right? That are working to help the newly diagnosed, right? Know that it's still worth working on and fighting for. There's a lot of different ways that we can use those peer connections. And talking about the stories, telling our own real lived life stories and experiences, sharing those stories with permission, of course, of what we see our clients and our patients going through and truly speaking those. Because if we're not talking about them, then nobody knows. And a lot of the times that's the way the system likes it, right? We don't want to rock the boat. We don't want to have troubles or issues, right? But if there's white elephants going on, we need to talk about the white elephants running around the rooms because we're losing people, right? Not just patients, we're losing good coworkers, right? People are leaving the fields, right? We can't get enough providers in the fields these days. There's a lot of different things to think about there. Mm. So I hope that we've talked about some things today and this has raised some questions for you about things that you can try maybe in your encounters, right? whether you're a nurse, a doctor, social worker, a peer, it doesn't matter what facet of the system that you're in, right? What's working for you right now? What's working for your clients and your patients? And what's not working? And how can we be truly open and honest with each other so that we know what the problems are? Unconscious biases, too. I did a training just last week on unconscious biases, and it was amazing. Yes, those kind of trainings are so impactful, right? Because we all have those, whether or not we like to admit it, right? Okay, I will be honest. I will share this with you. Shh, don't tell. Okay. I've always been a larger sized person, right? So there was definitely times in my life where I did not like, or I had a mental block and an issue with skinny, pretty women. Okay. I was like, "Ugh, ugh," right? But that was my bias because of my own issues that I had to work through. But if I have a client that walks in who is a beautiful, right? A beautiful woman that walks in and I have to work with that client, I can't judge her. I don't know her. I can't let my own issues, dysfunctions, or deficits that I'm continuing to work on and have worked on impact the care that I'm going to be giving to somebody else. Now, I use that as kind of a funny example, right? I usually get a little more profane with it when I share it, but I'm keeping a little more professional for us here. But that's real. It happens, right? If somebody walks in like your ex, who you absolutely hate and detest, are you going to have that moment where your head goes, ugh, right? The unconscious biases are important too, because we all grow and learn and we've come from different places. We have different beliefs, we have different morals and values that come with. Yes, Amy. Yes, exactly. Taking the time for self-reflection and knowing our triggers. Yes, being accountable for working on them actively and continually. Yes, I am a counselor. I have been a counselor now for 7, going on 8 years. Okay. I'm a counselor who goes to counseling. And I don't have any shame or judgment in saying that because I still am working on things from my past. I was a methamphetamine addict. Okay. I bought and sold drugs. I cooked methamphetamine. I
那早上
trafficked.
他们可能要给你量个血压，最后写个报告啊什么的，还要签一些文件，是吗？
I went through all of that stuff, right? Transference and countertransference. Yes, yes, exactly. So there's so much of that that I think that we really do need to be aware of. And that goes along with everything. One of the, I think, the biggest impactful things I ever learned, and this was in my associate's degree, right? So back in the day, is my professor looked at me and said, "You have to be healthier than the people you were trying to help." Oh, crap. Yeah, we do. And that doesn't just mean physically healthy and eating right and exercise and all of that, but it means here, right? And here inside of us. So yeah, that speaks exactly, Amy, that transference, that countertransference, being accountable to our own issues and working on them. Because as providers, as people that are trying to help other people, we can't do that if we're not taking care of ourselves and continuing to work on ourselves. That's huge. Thank you so much for sharing that. All right, tools for change. We've talked about this quite a bit. But really, for person first language, we've talked about that, right? The stigma awareness and training for all staff. If you in any way can, please advocate for this in your systems. Okay. The stigma awareness training, right? Looking at peer supported integration is huge. Again, not just in addiction recovery or mental health, coordinated trauma informed care across the table and true trauma informed, right? Those bridge building questions. Some of you had some great answers for those. Absolutely fantastic answers, right? How can I help you feel safe here today? What has been your experience with your healthcare system? And what would progress for you in dealing with this look like for you? What do you want it to look like? What are you looking for? And then that policy change, right? Removing barriers, shared language across addiction, mental health, primary care, pain management, and really truly building up those cultures of compassion. If you're a provider of any kind, or you're working in any of the helping professions, the medical professions, and you don't know anything about addiction, I would urge you to please, please get educated. Read articles, look up things, talk to people. I am from a population that I continually see, even to this day, dying off. I went to 17 funerals a few years ago. Hasn't been that many in the past few years, but they're still there. I watch on the social media sites and on the news programs and online and on TV. And I'm watching these people that I used to work with die. I'm seeing the people that walked out because they were treated with disrespect. I'm hearing their names whispered through EMS because they just picked up that person and unfortunately they weren't able to revive them. The stigma and the shame that our systems truly hang on to at times truly is and can kill people. And that's not what any of us are here for. I know that, or you wouldn't be here trying to learn and educate, right? One of the hardest things I've ever had to do is talk with the children of a patient that I worked with that overdosed and died. And this patient, I was very new in the field. I was working in residential treatment. And she was, oh God, had to be like my third client, right? That I ever had there. And they were feisty. She was feisty. Okay. Very, very feisty. And did not want to open up, did not trust the system, did not trust me, did not trust treatment, didn't want to open up, didn't want to share about anything, was completely what was labeled at the time non-compliant in treatment. And I remember wishing that she would just leave. I didn't want to deal with her anymore. I was so frustrated. I couldn't get through to her. I didn't feel like I could make any progress. I'm like, I'm trying to help you. What is wrong with you? And the behaviors continued. And we did end up discharging that client for behavioral reasons and for noncompliance in the program. 2 months later, I was sitting in my office on my lunch break and my phone rang and I answered it. And it was the 16-year-old daughter of that client. And I could hear her voice breaking on the other line of the phone, on the line. And she cried so hard she could barely get the words out. But she wanted to call and tell me that her mom had had an intentional overdose and had died. And then she proceeded to thank me for taking the time to try to work with her mom and for everything that we did as a treatment center to try to help her. I held it together on the phone. I'll tell you, as soon as I hung that phone up, oh, I cried. I bawled. I ugly cried, snot rolling out of my nose. And it was hard. I had to go to one of my mentors there and talk with them and deal with it. And I ended up having to take the afternoon off. I felt so heavy with guilt. It just ripped me apart for weeks afterwards. And I thought about how I felt about that client. And I didn't share those thoughts out loud, but I still felt ashamed, dirty, not good enough. I didn't believe that I deserved to be in the position I was trying to help other people. And I had to really process that out. And I realized that one of the reasons that that hit me as hard as it did is because I had watched time and time again as people were mistreated or labeled. And I watched as that stigma and that judgment and that shame tore them apart to the point where they truly did not believe that they could be fixed in any way, form, or fashion. It was hard. And it's not always an easy story to share because it is so raw and it is so real. But I think it's an important story to share. And it honors that person's memory because I will never, ever forget that client. And every client that I have moving forward, no matter how obstinate, right? No matter how much they don't want to do things, no matter how much they don't trust the system, no matter how hard they don't want to be there, that they still deserve to be treated with respect, that they are not their diagnosis, that they are not just the attitude that they are displaying or the behavior they are displaying at that moment, that they are real people with hurt and injury and shame who feel lost and alone and that nobody cares about them. And I know that because that's how I felt. But we're talking about this and we're starting to see changes. Again, millimeter by millimeter, right? Small progress moving forward. Us working together from different aspects of healthcare, right? Different disciplines, different, right, positions, working together to truly make people feel like they matter. That's how we start building some of these bridges, right? We are there to help our patients and our clients navigate this crazy system that we all work in, right? Whether you're in private practice or you're working for a larger healthcare corporation or anything in between. Because this change happens with us, with you, with every single person that lives and breathes and works in these fields, and every single person that comes to us. We're the bridge builders, okay? Whether you have a hammer at home or not, every day that you go forth and you're trying to help break that stigma and break that shame and educate yourself a little bit more and truly understand how to bridge the gaps for people, man, you're building the bridges. We are building those bridges, not only for our clients, but also for us as providers, as the people out there trying to help others. And where can we really see some of this change happen, right? It's not just in the clinic setting, right? Although, yes, in the clinic setting, pain management, chronic illness, recovery centers, but we also have peer support groups, right? Those smaller connections, right? The case management, those other programs, CCS services, all of those other things that we can integrate. Even working at the small level with our local towns and counties and truly trying to advocate for true policy change, right? And whether you're in more of the urban populations or the rural system, we still need to see those things change because it's across the board. It doesn't matter if you're in some teeny tiny little town way up north like I am, right? Or you're in Milwaukee or La Crosse or Madison. checking our time here. Oh, all right. So I want to share a little bit about what I'm trying to do out there. Okay. I've shared a little bit of my story with you guys. And thank you so much for listening. I really appreciate that. Okay. I am a I'm a counselor. I'm a substance use counselor. And I have started my own practice once I discovered I could, because I wanted to continue to work to build something that people could come to and they could trust, right? So I'm working on building not only one-on-one connections, right? That one-on-one care with my clients, but also helping them find community as well as finding the education, right? Because we kind of need the trifecta. So if you are out there, right, and you are looking for, maybe some education, some information on addiction and what that looks like, I write a lot of different articles. I have a blog that I write all about addiction, mental health, recovery, breaking stigma and shame, right? I share a lot of the same types of stories that I've shared with all of you today. Um, and I'm really working to help educate not only people in addiction and recovery, but the people that help them, the providers, whether you work in addiction recovery or you work in any other sector, because one way or another, we're all connected, as well as family members. So loved ones and family members that are affected by these journeys as well. So I do have my QR code that'll take you to my blog. My website is progressisprogressllc.com. I do coaching and counseling. And one of the biggest reasons that I've actually been doing some of the counseling is because there is such stigma on confidentiality and non-judgment. We have a huge number of people that will not go for services because they do not want the label on their medical records, because then that changes the entire game for them. Okay. Looking for alternatives, something a little bit different that still offers them services and support without the fear of that stigma and shame following them, can be a really nice caveat. Okay. Um, I have some of my other contact information here. I did want to leave a couple of minutes here to see if anybody had any questions, any comments, any ideas. I'd love to hear about any programs that you guys are working on or other things that are, in our areas, our state or surrounding areas. And thank you so much for listening to my presentation today. Thank you. I really appreciate being here. Thank you so much. All right, I see Oshkosh, we heart you, Home Solutions Recovery. Awesome. Thank you guys. Oh, thank you so much. I really appreciate that. Thank you. Thank you. And again, if anybody has any questions whatsoever, please feel free to reach out to me. I'm out there again, trying to be that person I wish I would have had early on. And if there's any way that I can help in any kind of conversations, please reach out to me. Let me know. I'm more than happy to collaborate in any way that I can with anybody. Thank you again.
Thank you, everybody. Thank you, Belinda. This was awesome. I really, really enjoyed it. And it sounds like just about everybody in here did as well. So thank you so much. To the audience, thank you so much for being here today, and we really hope you enjoyed the event. Don't forget to fill out that evaluation. That really does help us. We really do read those. And then that's also your ticket to get your certificate of completion. If anybody has any questions, you can email that ibhwt@uwsp email address. It's the same one that you got all of your confirmations and everything in. And we're happy to help, and we look forward to seeing you at a future event. Thank you, everybody. If you're in central Wisconsin, stay safe with the big storms that we have coming, and have just a great weekend. I'm going to leave the session open for a few minutes because there's a lot of links being shared, and that way, if anybody wants to grab those, you have time to do so. But thanks, everybody.
Thanks, Noah. Appreciate you.
Yeah.